Howdy, everyone. Matt here. I got a question for you. How much do you think perfectionism plays into physical therapy, whether we know it or not? And also, do you think that affects people's outcomes with doing therapy? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, and I'm coming at you with another video, another topic of something from the physical therapy world. And this one is about perfection. Do you think that we possibly push perfection too much, whether we know it or not? And do you think that affects people, whether they know it or not, or maybe whether we know it or not? And I want to talk about that. And of course, I want to hear your thoughts, opinions, and beliefs all down there in the comments. In talking about perfectionism as therapists, I think we kind of talk about like two separate things that go on and they can conflict with one another. One, we talk a lot about adaptation, how resilient the body is. And now I'm going to preface this saying I'm going to talk a lot probably along the lines of like orthopedics because that's my background and experience and that's what I do. And of course, if you work in another setting of therapy, please share your experiences and all that. But we talk about how resilient the body is and how the body can adapt and strengthen. You can do all these things because your body is so incredible. And I remember really learning about that in school in pediatrics because it was always like children were like the best example of it. So say like a child is born without a limb. And they would say, like, oh, well, they learn how to adapt and function even though they don't have a limb. And it's like, oh, that's really, really cool. Or maybe they have a brain injury or not a cognitive, but a congenital disorder that they're born with, and they're like they learn how to adapt and function and live and do this. And we would look at that and go, wow, that's so remarkable. And there's other cases of people doing that all over the place. That one thing I learned again in the McKinsey training, we talked about how the body adapts, and there's some drawings. I believe it's from like King Henry's Anatomist. I'll put the pictures up through here of people who had dislocated their shoulders and hips. And in these drawings, these people formed a new glenoid, they formed a new acetabulum in their hips. And we talked about, oh, look how resilient the body is. It was here and it formed these new joints here. So we're saying, look, the body's not perfect anymore, but it's still very, very functional. But there's this other side. Now, I understand people like to talk about with therapy that we say these things about like, oh, I've seen the jokes. Oh, you're not sitting right. I know you're going to throw shade at the McKinsey person. You're not sitting with that good posture there. You're not sitting perfect, so that's why you're having problems. Oh, you're not perfectly bending over to pick up that thing off of the ground, so that's why you have the problem. You're not perfectly squatting there. You're not perfectly walking, and that's a part of it. And we talk about that, and there's some thoughts and groups of people who do those things. I've seen the silly, I'm just going to say it's silly, that's my opinion, of those things that like put people in like this perfect posture. They just like strap them all in and they're like sitting in this real like crazy position. And they're saying, oh, fixes your posture. And it's so great because it's putting them into a perfect thing. And again, there's therapists that talk about like, well, no, that's not actually true. But we talk about that. Well, you're not squatting quite right. So we gotta like move you this way to teach you how to squat right. Oh, you're not lifting correctly, and we need to get you to kind of come down, keep it close to you, and to lift correctly. And so, are we possibly putting in these negative thoughts about movement like that? Additionally, thinking about with perfection, with like motion and things like that. Oh, of course, like I said, you're not sitting and walking correctly, but think about like your range when you assess somebody with their range. Are you going like, oh, are you limited in your range? Think about with the shoulder. I remember in school, the norm was 180 degrees. I can't tell you, I probably only had a handful of people who ever hit 180 degrees. And it's like, oh, well, you're not, in the norms for it, but they're very, very functional. And are we saying something negative to a person that's saying, like, oh, well, you don't, oh, you're limited in that motion? What about like strength as well? Oh, you have weakness in here. So if we say weakness, that means you're not perfectly strong. You're not strong, which is, or you're not perfect. And that's what's causing a problem. So do we happen to have these aspects of a perfectionism that we're putting in there, that whether we know it or not, that we're telling people that you're not doing something perfectly, correctly, the right way, and that's causing your problems. Even though we'll sit there and tell them, your body's incredible, it adapts and do this stuff. But on the flip side, we're saying, well, you're not quite right. You have this weakness here that's causing you problem. That we throw this imperfection in. You know what would be perfect? If you like the video, to hit that thumbs up button and subscribe to the channel. Back to the video. I think as therapists, we do need to have some aspects that we talk with patients about perfectionism and perfect just to ensure that they don't develop this unhealthy belief or something about perfectionism in with therapy and stuff. And I think it goes into a couple areas, and that's what I'll talk about. I do think we really need to be careful on how we talk about like adaptation and like perfectionism, because I think that there are times when people get so focused on things being perfect, it can limit them. Take, for example, like with like squatting. That is a big one I've seen like in the fitness world, that people get so focused on how they squat. Oh, my knee just shifted in a little bit. Oh, my hips went to one way a little bit. Oh, I leaned forward a little bit. I got to drop the weight another 20 pounds and I got to work. Oh, I'm just not perfect. And there's been individuals who have said like, I chased that for years and I was getting weaker and weaker, and it was messing with my head, and I wasn't, in a good mental space, and I couldn't do this because I was so focused on perfection. When then they realized like, look, my body's going to adapt. I'm okay with doing this stuff. It doesn't have to look, absolutely perfect. I can be great and do all the things I want to do, even though I move, this looks like that. And I do believe that that's an aspect of things that we should encourage in people, that your body will adapt and you have to work with how you are. I think we also need to be aware of like how we speak to people about stuff. If we talk to things about like, emotion, oh, you're limited in motion, you're limited in strength, oh, you look some weakness here, oh, you don't sit right here. But being aware that we have to maybe, put some quantifiers on it to say like, oh, there was a thing one of my bosses used to say, when you like test somebody in something that you find, you may find something that it's like, well, this is really not a problem. Like I said, like the shoulder motion, somebody may not reach 180 degrees and it's like, oh, well, you don't reach 100 and, reach all the way. But he would joke and say, well, that doesn't mean you're a bad person or anything. So that was just a little joke he threw out there. But it's like, if a person has 140, 150 degrees of shoulder flexion, it's not full, but they're functional. They're doing this stuff. Do we need to tell them like, oh, you're not all the way there? That's a problem. And even like strength, the assessment of strength can be pretty subjective on it. I'm a big guy. I can apply a lot of force to people when I do it compared to someone who's maybe 100 pounds less than me. They may not, and again, I may tell somebody that, oh, you got weakness, but this other therapist told them, oh, no, you're strong. And I think we do need to kind of put those caveats and things in there to say like, no, that's okay. It doesn't mean anything bad. It doesn't mean anything wrong. But, just say that. Now, I do think we do need to correct things at times when we talk about like lifting form. And I do believe there is, again, an aspect. I think it's more kind of like guidelines. If we think of somebody lifting something, if everything that you're doing, you're just like rounding your back really hard and you're just using this straight back, it's like, hey, I probably want to talk to you about how to do that. I probably want to educate you on how to do that, just so you just possibly don't get hurt down the line. I'm working with my kids on lifting now. They're getting into sports, and it's the thing about it. And, I hear that little voice in my head when we talk about, not running around the back, because that's how they want to do it, about like, I don't want to say a negative thing where they're going to get possibly so focused, like, no, my back has to be straight. But it's like, how do we really get into like talking about that? I would even say with like walking, that there are aspects that we can talk about with like walking, that, oh, okay, maybe you do get a little bit of a deviation. For example, like knee replacement patients. That's a good thing. Example. I've had knee replacement patients that have had their surgery and they come in and they have this limp. And well, the thing is that they had the limp before they went into surgery because of the pain, and they went after the surgery now and they're having that limp. Okay, let's train this limp out of you. It's not that you don't need to have that limp anymore. And we're saying like, well, you weren't walking in almost like perfect way, but you're going to walk that your way. And so I do think that there are some of those aspects of it. And there's one other area that I was really thinking about how this perfectionism can just affect people's outcomes with therapy. So like I mentioned early on, the author that I was listening to was talking about like people are so good at starting, but they can't finish because they don't, it's not perfect. I'm not doing everything perfectly right. I'm not staying perfectly on task. I'm not doing this every day and having a perfect streak of doing it. And so they fall off the wagon of doing it and then they just stop. And is that something that comes up with therapy? So that when we work with somebody, like our home exercise program, I gave you this sheet of exercises. There's 6 exercises. And I want you to do 3 sets of 10, just the way I have on this sheet, and do them 3 times a day. And if that person finds out like, well, I didn't do them 3 times a day. I didn't do them the 3 sets of 10. I skipped one. I skipped a day. And then they fall off because it's like, well, I didn't do it perfectly. So I'm just going to stop. I can't do that. It's kind of the same things that people may do of like, oh, I didn't, run every day. I fell off. And so then I just stopped. So is that something that can come into therapy? Why people don't do well is because they can't do these things perfectly. And they have that in their mind to say, no, I didn't do it right. Oh, like the exercises, even same with like how they move or how they do to say like, well, you're not squatting right. So I don't want you doing any of that at home. You can only do it in here. Or, those things. When somebody misses an appointment, you're perfectly showing up to every single one of them, but they missed on Friday, because they forgot or work or something like they think, oh, that's going to throw me off. Think those things. Can those affect? Do you think that could affect it? Do you think that needs to be part of an aspect of it? And maybe cutting people some grace and talking about like, look, I understand that things come up, things happen. You may not get the exercises in as instructed. You may not get them, but if you focus so hard on the perfect, then you can just say like, well, if it's not perfect, I'm just not going to do it. But it's like, get them in, get this in, do this. I know one thing I've done with patients when I give them exercise to do at home, I may tell them, I would like you to do these X number of times a day. But if you can't do it, and if you can only do 1 or maybe 2, do these. That's what I want you to focus on. If you can get something in, do these little things, this, that. It's with at least that you're doing something. Or if people feel like, they're not consistent with coming in, it's like, hey, what's something that we can do to break that down, to make it smaller, to reach these little things rather than think of this big goal. Let's focus on these little things. And so, I started thinking about that how much of that perfectionism that we want and strive for can just end up just affecting people so much. And maybe it affects a lot. Maybe it doesn't affect that much. Maybe it only affects certain people. Maybe it affects everybody. Anyway, so of course, let me know your thoughts, opinions, beliefs, your experience with it. Do you think perfectionism affects us really hard in therapy, whether we know it or not? Does it carry over to patients? Do you talk to them about perfectionism? That you don't have to be perfect. Okay. We're all kind of flawed individuals. Do the best that you can. If you do your best, hey, that is going to be inconsistent. Do it. What are those things? And like I said, I just kind of feel like maybe that was a little slip up there. Staying consistent, so you're staying perfect. I don't know. Let me know. Let's talk about it. Let's have a discussion on it. If you enjoyed the video, hit that thumbs up button. Please consider subscribing to the channel. It doesn't cost you a copay or anything like that. And until next time, take care of yourself. Take care of your patients. I'll see you then.